All right, Mr. Williams here again to talk a little bit about attendance. Previously, daily student attendance, tardies, and dismissals were tracked by Aspen. That's in last year how we would do things. But now, due to the remote setting, we need to make sure that we're taking period by period attendance. And the goal of that is to watch closely to make sure that you're participating in your entire day of learning, making sure that you don't accidentally drop off after flex or drop off after a mass break, but that you're making sure that you attend every period in a way that we can't ensure like we typically do when you're at school. So once we move to attendance, once we move to the hybrid situation, which will be in person, it's going to be really important that you consider this before you attend school. This you don't really have to think about in a remote setting because you're at your home and you're not in danger of spreading anything to any other friends. But what you need to do is make sure that if you're feeling any of these symptoms, nausea, vomit, diarrhea, fever, chills, fatigue, sore throat, cough or shortness of breath, runny nose and or congestion, headache or body aches, or loss of taste or smell, we really are recommending that you stay home, as those are some early signs and some symptoms of COVID-19. When we take attendance in a hybrid situation, it's going to be similar to your old-fashioned school. You'll come to school, you'll follow your schedule, but it's of the utmost importance that you are coming to school. And if you're not, if you're missing classes, whether they be remote or hybrid, it is going to lead to communication from your teachers, as well as administration and your family, to make sure that you're able to attend school in some fashion and make sure you have access to your learning. If you aren't feeling well during the day, this is going to be really important. Just so you know, if you feel like you start to feel any of those symptoms, please go to the nurse and we'll make sure that we'll take care of you. If the nurse decides that you are experiencing these symptoms, we will put you in our waiting room and make sure that we have someone to come pick you up. And then there's a process from there that the nurses will discuss with your family.